Так, excuse me. Where is our tumors? Endometriosis. We pass. Так, benign tumors of genitals. Yes. And please, we begin every time from Tchunia. Tchunia, read the test, please.
Yes. A 27-year-old woman complains of having disorders of menstrual function for 3 months. Irregular pains in abdomen. On bimanual examination in dextral appendage range of uterus, there is elastic spherical formation. Painless, 7 centimeter in diameter. In the right ovary, there is a fluid formation, 4 centimeter diameter, unicameral, smooth. What is the treatment most preferable? Prescription of estrogen gestogen
Yes.
complex function check.
Why? Do you remember we have this test in the previous test? Can you remind why we don't perform operative treatment at once?
Because we first start with conservative treatment, yes.
No, conservative, yes. But do you remember I told you, and today I told you that we have functional cysts that can disappear without
Yes.
spontaneously, sometimes without any treatment. Yes.
Mhm.
And she complains not prolonged time, only 3 months appear these disorders. Yes, disorders of the menstrual function. Then what? Ovary. It is fluid formation, unicameral, smooth. Yes, there is no any papillas, no any disturbances about it. Yes, fluid formation. As soon as possible, it is functional follicular cyst of the ovary. Yes, usually occur due to the decrease of the level of estrogen and progesterone. Yes, and that's why we indicated estrogen gestogen complex. We call this replacement hormonal therapy, prolonged 3 months, and of course monitoring this woman. If the cyst is not disappear, we suggested operative treatment. But first of all, we need to begin from conservative. Yes, young woman, no any reason to remove at once ovary without our monitoring. Yes. The next one, please. Navjot Singh.
A woman consulted a doctor on the 14th day after labor about sudden pain, hyperemia, and induration of the left mammary gland. Body temperature rise up to 39. Headache, indisposition, objectively fissure of nipple, enlargement of the left mammary gland, and pain on palpation. What pathology would be you think about in this case? Lactational mastitis, because the lactation period is start on the 14th day after the labor, and there is the enlargement of mammary gland.
Guys, lactation start not on 14th day when appear real milk. First of all, 3 days after labor, it is colostrum. Milk with decreased content of fat, yes, and after 3 days appear real milk. Yes, but no, maybe we have here topic diseases of mammary gland, yes, of diseases of mama. I want to say that a lot of tests devoted to this topic, yes. In some cases it is mastitis. Usually you think about mastitis if the woman has labor. Yes, you have here a labor. That's why, first of all, it needs to be mastitis. Yes. Then body high temperature, indisposition, fissure of the nipple and enlargement, pain during palpation. Yes, no, you have here lacteal cyst without suppuration. Here, no any signs. They don't describe you that present cyst. Yes, fibrous adenoma. Usually, it is they describe you the movement without labor. Breast cancer. Also, what we have if it is breast cancer. My dear, can you answer me?
Inverted nipple.
Who answer me again? What we have, which is breast cancer, please repeat.
Inverted nipple. Inverted nipple.
Да, мгм. Yes, and what happened? Retracted nipple they give you, yes, usually. Sometimes pus or blood discharges from the nipple. It is the cancer, but never they give you the cancer together with the pregnancy. No, there was no cases. Then phlegmon of the mammary gland, but here we have no господи, when a soft tissues in the middle fluctuation. There is no fluctuation here. Yes. And that's why you need to choose lactational mastitis. Guys, the next, number 3, and так, Kaushal absent today, yes, Shanil? That's why can't please read.
A 32-year-old woman consulted a gynecologist about having abandoned long menses within 3 months. By manual investigation, the body of uterus is enlarged, according to about 12 weeks of pregnancy, distorted, tuberous, of dense consistency, appendages are not palpable. Histological tests of the uterus body mucosa, adenocystoles, hyperplasia of endometrium, optimal medical tactics. Surgery.
What kind of surgery and what pathology has this woman? Can you tell me? I told you about this test. Guys, excuse me, I make a pause for tomorrow. It is background and malignant diseases of the female genital organs. I hope it will begin at 9 o'clock, but if something happened, I will call your monitor. Now we have 9 minutes, and very quickly tell me why surgical treatment, what kind of surgery, and what diagnosis we have here.
Hyperplasia, yes.
Guys, no, listen me very attentively. I told you about this test. Woman has profuse menstruation, prolonged 3 months. What doctor reveal? Body of the uterus enlarged to 12 weeks of pregnancy. It means what? Usually they describe you in this way, fibromyomes. Yes, fibromyomes of the uterus. Size of fibromyomes, we consider to be large. Do you remember that indications for operative treatment, it is the size of fibromyomes more than 12 weeks of gestation. Yes. What's bad here? It is adenocystic hyperplasia of endometrium. We will speak about it on the next classes. It is very bad kind of hyperplasia, very often cause the development of the cancer of endometrium, carcinoma of the uterus. That's why size of the uterus, presence of bleeding, plus hyperplasia of endometrium, of course, it is indication for surgical treatment. Hormone treatment in this case don't give us really good result because large size of the tumor. Phytotherapy at all, the effect of this therapy unknown. Radial therapy, in this case impossible, young woman. Radiotherapy, they kill the work of the ovaries. Vitamin favorite tool, it is no any reason to speak about vitamins. They cannot help in this case. The next, number 4, please, Mandeep Singh, present.
Yes, teacher. A
Read,
40-year-old
please.
woman has change of mammary gland. What are the most often symptoms that precede the malignization? Skin induration and inverted nipple.
Skin induration with the inverted nipple. They suggested you other options. Painful movable, painless movable induration, usually immovable if we speak about the cancer, yes. Then bloody discharges may be present. And pure discharges also present, but the evidence signed, it is skin induration with the inverted nipple. You need to choose more evident sign. Number 5. Number 5, and please Milimba. Milimba present or not? Be quick, Hinha. We have 5 minutes. Kinda. Hinda, да, yeah? Milimba? No, yeah? I put him absent. The next. Please read Mahanti. Mahanti was present, I know. Read the test,
A
please.
29-year-old patient underwent surgical treatment because of the benign serous epithelial tumor of the ovary. The post-operative period has elapsed without complications. It is necessary to prescribe for the rehabilitating period. Yes,
No.
teacher will prescribe hormone therapy and
Yes,
fertility pills.
because we have this test, as you remember. Yes, if we remove the ovary, of course, we need to add some hormones. Yes, that's why hormone therapy, proteolytic enzymes to prevent the development of adhesions. Yes,
Yes.
так, Natalia, please read number 6.
A 40-year-old woman has a self-detected hard breast mass. The procedure of choice for confirming the diagnosis is excision biopsy.
Guys, yes, of course, if we have disease of month of the mammary gland, of course, it is biopsy. Yes, mammography can show us that present any pathology. Thermography, no, maybe temperature only. Ultrasonography also presents. After sonography, we need to send the woman to mammography and then to biopsy. Of course, more exact method if we speak about the mammary glands investigation, it is excision biopsy. Aspiration biopsy possible if we speak about the uterine cavity. Number 7, and please need him.
A 30-year-old patient complains about inability to become pregnant over 3 years of married life. The patient is of supernutrition type. She has hair on the median abdominal line, on the internal thigh surface, and in the peripapillary area. Menses started at the age of 16. They are infrequent and non-profuse. Ultrasound revealed that the uterus was of normal size. Ovaries were 4 into 5 into 5 centimeter large and had a lot of cystic inclusions. What is the most probable diagnosis?
Yes, we know that a lot of cystic inclusion, polycystic ovarian. Yes, polycyst, a lot of cysts. Yes, we speak about this test on the last classes. Then, please, Yamin, read the next one.
Yes, parturient complains about pain in the mammary gland. Operation reveals 3 into 4 centimeter large infiltrations soft in the center. Body temperature is 38.5. What is the most probable diagnosis? It's acute purulent mastitis. She has a fever and there's the infiltration.
Yes, we have fluctuation. That's why purulent acute mastitis. There is no other pleuritis, birth trauma, no
Yes.
other diagnosis which is proper for this test. The next number 9, it is pretty. Please read.
A 59-year-old female patient applied to a maternity welfare clinic and complained about bloody discharge from the genital tract. Postmenopause is 12 years. Vaginal examination revealed that genital organs had sign of age involution. Uterus cervix was not erosive. Small amount of bloody discharge came from the cervical canal. Uterus was of normal size. Uterine appendages were unpalpable. Fornices were deep and painless. What method should be applied for the diagnosis? This is curettage, separated diagnostic curettage.
How you understand separated diagnostic curettage? Usually more budget to say fractional curettage. We perform curettage of the cervical canal, put in water bottle, and further we make the curettage of the uterine body in order to localization of the pathological process. We have, guys, less than 1 minute. In women with climacteric bleedings, if they come, it was period of pause, menopause, and then appear bleeding. Usually we perform curettage in order to make the diagnostic. It's maybe cancer in most of cases. For prevention, for the early diagnostic, we to every woman perform diagnostic curettage of the uterus, even if the woman has dysfunctional bleeding and not so old, guys. Remember, bleeding in postmenopause, it is curettage, maybe separated, maybe fractional curettage of the uterine cavity. No, guys, number 10 here, endometrioid cyst, and we have this test. Suresh, you will answer me on next classes, guys. Now I want to